This is Our People podcast, telling the stories behind South Tyneside and Sunderland NHS Foundation Trust.
Hi, and welcome to this episode of Our People podcast. My name is Harry Newhouse, and I will be your host. On this week's episode, I have the pleasure of speaking to clinical lead for Sunderland Integrated Musculoskeletal Services, which is also known as SIMS, and sports and exercise medicine consultant Dr. Glen and physiotherapist Nia Woodhouse. Welcome.
Thank you.
Glen, could you please tell us a little bit about yourself and the work you do here at the Trust?
Yeah, so thanks very much for inviting us to speak from SIMS. So I come from SIMS, as you rightly say, a community-based service, which is basically musculoskeletal, so conditions within Sunderland and from referrals from any GP in Sunderland. So I'm a consultant in sports and exercise medicine. My work is split pretty much 50-50, perhaps a little bit more towards sport than purely musculoskeletal. So my background, I'm from Sunderland originally, so quite passionate with regards to the area. Trained in Leeds, in my sort of undergraduate medical degree in Leeds, with an aim that to always work in sport really. So I was the head of the medical department at Sunderland Football Club for over 20 years. I left last October and have taken a role with England senior men's cricket. So I do a little bit of horse racing, looking after the jockeys rather than the horses. And within the NHS, work within the SIM service. That's pretty much where I come from.
Nia, as a physiotherapist, what does your work involve, and how did you come into the role?
So I'm actually a rotational physiotherapist, which basically means that I rotate around the hospital in different specialisms. But I do often forget that because I've been on SIMS for a while and I will be on SIMS until next year. And my role involves taking those referrals from the GP, and we cover top to toe musculoskeletal conditions like Glen was saying. And I will assess those patients and have a diagnosis. It's generally around pain, so where's that pain coming from? And then we'll work together on a treatment plan, so based on what that patient aims to get back to functionally. And that can be exercise rehab, and it can be sort of manual therapy or the sort of modalities of therapy. And I had a bit of an unconventional route into physio because I did a undergrad in molecular biology, just loved science and biology, and went into software sales after that, which I absolutely loved my job. But ultimately what was missing for me was working with patients in a healthcare setting to use my biology to help people. So that's sort of how I ended up in physio. So I've put all of my experience together and ended up in a role that I really enjoy.
Oh, brilliant. And when we mention the phrase musculoskeletal, shortened to MSK, what do we mean? What kind of conditions or complaints are most common?
So MSK, like you said, is musculoskeletal, and it basically is what it says on the tin. So generally conditions that affect your joints, bones, muscles, tendons, and nerves. So generally it's going to be pain that we're seeing, like I said, but it can also be persistent pain that we see. Conditions and complaints that are most common, I would probably say obviously a lot of back pain that can be mechanical, so how muscles and joints are interacting, or we see a lot of arthritic joints as well, so people often say sort of wear and tear in the joints, whether that's in the back, the knees. We see a lot of different joints that are affected by that, but like I said, we work with people top to toe.
Glen, you're a clinical lead for SIMS, please could you tell us what SIMS is and how it helps our patients?
Yeah, so SIMS is Sunderland Integrated Musculoskeletal Service, which basically it was a CCG commission service, which basically means that the primary care, so GP practices and all associated with it, felt that they required a more specialist musculoskeletal service to refer into. So integrated or intermediate basically it puts us in between primary care. So when a patient goes to see their GP, then most referrals will therefore go to secondary care, i.e. in the hospital, whereas we sort of fall in an in-between area. We truly are a multidisciplinary team in that we have a range of different clinicians and individuals working within that service. I think MDT gets sort of bandied about quite a bit, but I think this is one service that genuinely does fulfil what it says on the tin. We have obviously myself as sort of consultant in sports medicine, and we have a number of other doctors within the service who the majority are GPs in Sunderland, but also further afield, who've come to work in this area. So they're within Newcastle, South Shields, etc. will come to do their clinics here, and they are a GP with a specialist interest, but also postgraduate training in musculoskeletal conditions like Nia's described, so any muscle tendons, ligaments, whatever that may be. We also have a range of physiotherapists of different banding, from band 5 on rotations all the way through to band 7 and band 8 physiotherapists within the team, so an extremely huge amount of experience and different skill sets. We also have TIs, so technical instructors. So we have one technical instructor currently, and we've literally just advertised and shortlisted, I heard this morning, to bring at least one more technical instructor in. And they come from a range of backgrounds, and they may have worked as physio assistants, perhaps in hospitals, and as sports scientists. So with the degrees in sports science, are very keen to work within the NHS, and that's a perfect way for them to come into the service and be able to start working with real life patients basically. I think the push that the TI's role is very much from a rehab point of view and exercise management, to be able to show they've run classes to be able to show how to do those exercises very well, so you get the majority out of the exercises. There's very rarely bad exercises, but there is not brilliantly done exercises for many conditions, and that's where they play that role. Now we have a extensive administration team, because we receive around about 3,000 referrals a month into SIMS, so it's a very big service, yes, that's pretty much what we are. We're based all over Sunderland, so we have clinics. We do have some clinics within the Royal, within the hospital, but the majority of the community. So we're based over at Houghton Primary Care Centre, Washington Primary Care Centre, Grindon, Southwick we've just moved into to a nice new sort of facility there that we work from, as well as some on occasions Riverview, Springwell, so right across the whole of Sunderland, and receive referrals from primary care, so from GPs, much more now from practice nurses, from paramedics who are working within the different PCNs, so the primary care networks, and we're an option for all those referrals.
If people are experiencing pain or problems with their mobility, what should they do, and what goes into someone being referred to your service?
So the patient will usually see one of the clinicians within primary care, and a referral then is sent in the same way the referral to the surgeons or dermatology or any other secondary care. It's exactly the same process. The referral comes from the GP. Those referrals are then triaged, so by myself and a number of our senior clinicians will look at the information that's available on that referral, and the idea of triage is to get that patient to the most appropriate person first. So for example, if it's someone who has had a week of back pain, a couple of weeks of back pain, then the truth is that there's no point in them seeing me, because I'm not going to be able to help them to the degree that Nia can. Whereas Nia would be able to get them up and about, explain what they need to do, strengthen exercise and mobility exercises, and she's far more skilled than I am in anything of that nature. Whereas if there is perhaps more chronic problems or other types of problems that it may have already utilised physiotherapy and exercise, then they'd be probably more likely to come to myself, for example. So there's a referral from primary care, but what we found, interestingly, through COVID, when we obviously during lockdown we actually never shut. We continued, but we couldn't see patients face to face. So we did as many. So we contacted all our patients that were referred to us. We continued accepting referrals through that time, and we spoke to patients purely on the phone, because that's all we could do. And we found that it was sort of 69, nearly 70% of patients that were referred to us and were given advice and given exercises and referred to our then website of the information on there. 70% didn't need anything further. They didn't come back to us within the next 6 months. And as we are the single point of access for orthopaedic problems, they would need to come through us either as a self-referral, where they, because they're in the service, they could contact us directly to come back within that period, or via a new referral. And we found that it just proved how useful exercise and loading and mobility is for many, in the majority of conditions. So the reason I mentioned about the exercises is that we have an extensive website and an online app called Move With Me, and patients as well as staff will see in GP practices lots of posters and QR codes, and on the website, so on sunderlandims.co.uk, then patients can register onto that site and use the information on there. And that is we've got a library of over 300 videos of our own physios undertaking the exercises that we think are useful, and directing for the knee pain, for example, the specific exercises that people can use first off. And the truth is, by doing them, the high majority won't actually need to take time off work to come to appointments, etc. And they can undertake that. So I definitely recommend patients to directly sort of use that, but also my colleagues within the hospital, and also in primary care. It's a really useful resource.
Could you tell us a bit about what sort of investigations and treatments the service has to offer?
Yeah, we have access to, we can, so we will see the patient, and the majority I'm very pleased to say we can manage and help that patient's problems settle, and for them to manage that problem, or to cure it basically. And that involves a range of, sort of treatments from physiotherapy and exercise management to, we do injection therapies. So we have ESPs, which are extended scope physios, who have access to diagnostics, which I'll come back to, as well as injection treatments. We do, from an investigation point of view, we can access whatever we need, the most appropriate investigation depending on that condition. So X-rays, MRI scans, ultrasound scans, CT scans, we have access to the whole range. Also, blood tests are also required for some musculoskeletal type conditions or possible diagnoses. And from a treatment point of view, we will use steroid injections. We also use a range of different injections. So we will do blood injections. So for some tendon conditions, for example, we can take blood out of the patient's arm, and on the theory that there is growth hormone within that blood, then that can be injected in tendons to try and trigger more of a response than we're getting from exercises alone. We have access to ultrasound guided injections within the service. So rather than referring to radiology, etc., we can do those within the service. So a lot of these procedures are ultrasound guided. So if it's difficult to access the joint, for example, we can use the ultrasound. We also do things like hydrodistension, which actually we had a paper published probably 2 years ago now on hydrodistension for frozen shoulders, which is an extremely painful condition with excellent results. So we offer that within the community here. I know in some of the shoulder consultants will offer that in theatre, but obviously we can manage that a lot quicker and without the need for surgery for theatre involvement. There's one of my colleagues over in Newcastle who's a consultant radiologist, offers us in a clinic setting too. But I think other than that, I think they're the only two places that do offer that procedure. So,
and Nia, as a physiotherapist, what sort of conditions and treatments do you specialise in?
So, like I said before, we see a wide range of areas of conditions within the umbrella of musculoskeletal. So we'll see anything from an ankle to a neck. So we're all trained in being able to assess joints, soft tissue, nerves, to be able to find a diagnosis. And in terms of treatments, we often go down an exercise therapy route, and we'll work to use sort of evidence-based practice for that as well. Like Glen said, we've got a multidisciplinary team, so we can work with our specialist physios, GPs, and with our technical instructor to basically formulate the best treatment plan for the patient. We like to try and personalise it as much as we can, rather than having a cookie cutter approach for each person. So it really depends on what the person wants to achieve. Do they want to get back to a specific sport? Do they want to try and reduce some pain? So that's how we basically personalise it around them.
Perfect. And so Sims is based in Sunderland. Do we have any the same or a similar service at South Tyneside?
Yeah, so IMAT's services, which is an integrated musculoskeletal assessment and treatment services, are all across the country these days. One of the first, which came about, I think probably the second in the country, I believe, was actually in South Shields. It was in South Tyneside, and I started working there back in 2007. And then one of the doctors who I worked with there has now joined us. A number of the doctors who were there have also joined us over in Sunderland now. So the IMATS clinics are available sort of nationally. They all vary from what they offer, and the clinicians involved, obviously. What we have in Sunderland is, as I say, a true MDT, and I think the size of the Sunderland service and the great variation in the types of treatments we can offer is as good as anywhere else that I know of. So I was previously an elected member of the Faculty of Sports and Exercise Medicine, in which colleagues within my speciality, it's their faculty in there, and on discussing with those colleagues, I certainly don't think there's anything that we don't offer that is available anywhere else. So I think it's a service I'm very proud of, to be perfectly honest, and I'm very keen to continue developing, and I think we see that from the feedback we get from people. So in South Tyneside there is a musculoskeletal service. It's provided by a private physiotherapy company, so it's somewhat different to SIMS.
Right. Are there any other projects that you've been working on within the service? Or?
Yeah, so like Glen mentioned, we have launched sunderlandims.co.uk with the Move With Me feature, and that's definitely something to shout about because it really is interactive. It means that patients have access to their rehab from home, and it's not just exercises on a sheet. They're sort of brought to life with our physios and explaining what's going on in those exercises, so it helps with form to make sure that they're doing exactly what they need to do to help to get better, and that means that patients can get self-help as well, and like Glen said, our colleagues in the hospital. We've also been looking at improving our arthritic hand service in the team, and that's basically been a working group with all of our clinicians to look at research on best practice for arthritic hands, working with other members of the wider MDT, so working with occupational therapists, and ultimately trying to improve our service so that patients can better self-manage basically a lifelong condition that can be very painful. And I think that's something that we're always looking to do on SIMS. Definitely, I've noticed from my time, there's always going to be room for improvement. Whilst it is an unbelievable service, we're looking to what's the newest research, what can we do to improve. So that's what we're working on at the minute.
The other thing that is involved, we do encourage and are always involved in research. I mentioned about the research for hydrodistension, but there's other sort of research products that are ongoing. We do take medical students who are particularly interested in musculoskeletal and sports medicine, and a number of the research projects that have been done there, for example, we've on 3 occasions won an award at the BASM, which is the British Association of Sports and Exercise Medicine. By presenting the posters that they've done, and they've worked on, have won the prize there, which is great for the medical student, but it also gives something different for the staff involved. And I know our staff very much enjoy having students with us, and we're very hopeful we'll be taking more physio students in the future, partly involved in research, but also learning the clinical skills. So there's the teaching element that we're certainly pushing. We've just had an away day, so CPD and development within the team, as Nia said, is really important, and we need to continue with that. And we have extremely strong links with our orthopaedic colleagues, rheumatology colleagues, pain colleagues, who are probably those teams that we refer on to the most. And they are very keen to join us in our monthly meetings, providing CPD, as well as the away day, but also consultant colleagues from other teams and other trusts. We had an away day on Tuesday, which one of my colleagues from the QE very very kindly joined us to talk about his specialist area. So lots of things ongoing. As I said, the technical instructor is something that I think is something we can really push. I think from my time in sport, I completely understand the importance of getting people back to work, but also that there's more to life than just work. And we have a lot of amateur sports people out there who are keen to get back to that sport. And I think that end stage of rehab is probably something, because of NHS pressures, that we probably can do better. And I think that's something we need to be looking at to get people back to their sport, rather than just getting them back to work to do what they have to do, but more what they want to do.
And I think after COVID, especially, a lot of people got into sports as a way of form of exercising when it was locked down, and I'm sure that they would just want to get back involved into what they're doing. So it's not just professionals as it is for just every person who goes for like a five-a-side every week.
Absolutely, and those people walking more, doing the things like couch to 5K, for example. There's often a slight worry that the exercise will cause arthritis and it will make arthritis work, for example. What we know is actually by keeping mobile and strengthening everything else is actually beneficial for those conditions with those conditions too. What we have found since you mentioned COVID, God forbid if we didn't at least mention COVID once during the hour. We're seeing a lot more neck problems, upper limb problems, and it's related to back problems, and it's very much related to more people working from home, but obviously not, certainly during COVID when, before desks and everything could be sent from Amazon and other suppliers, we see a lot more of those type of problems now because of not working at a standard standard station. That's certainly increased our workload, but it's nice to be able to help people with those problems.
So for anyone listening who may think that this is something that they would like to get into as a career, or like what is Sims looking for, and what the wider careers associated with MSK?
Yeah, so Sims is very much an MDT, so a whole range of different clinicians are required and needed within the team. Recruitment can be really difficult, and I think every different area's found recruitment difficult. Since COVID, as I say, we've got jobs out at the moment. So there's actually Band 6 physio job is about to be advertised. There's one just been advertised, which we're about to interview for, and there will be more over the next few months. So anyone who is keen to get involved and be involved and work within Sims, I'd strongly encourage them to. I think it's a great place to work. I think it's got lots of a huge amount of different opportunities, if they wanted to get in touch with the service, then please do, and we can talk more about that. Certainly from a physiotherapist point of view, any doctors with interested in musculoskeletal care, be it GP, be it from elsewhere, then always keen to increase that team.
I would second that as well. From an employee point of view as well, it's a really supportive place to work. So as a newly qualified physio, I had support from the GPs, from the specialist physios, and from my colleague physios as well. I just felt really supported, and everybody likes to share ideas, and we have an open door policy so that we can work together on sort of patient rehab and how we're going to work together to get them better. So it's a great place to work.
I think, to be completely honest, it's not an easy place to work. There is a high workload. I think musculoskeletal care, in general, attracts people with extremely good work ethics and who are dedicated, keen, and passionate about that work. If you want an easy job, then it's not Sims, it's not musculoskeletal. However, if you are passionate about it and you want to become as good as you possibly can, then I think it's a great place to come work and learn from others. I genuinely believe that I've learned more from my physio colleagues over the last. This is not to say I know everything from a medical point of view at all, but I've definitely learned more from my physio colleagues over the last 5-7 years than my doctor colleagues, to be perfectly honest. The physios will look at things with a slightly different viewpoint. The movement of patients, etc. They will look at that much more than perhaps the doctors do in general. From a learning point of view, and another positive to come to the service, as I say, CPD and personal development is really important to all of us. We do look at slightly different take on things, and we'll get external speakers in, etc. So, for example, we had a colleague who's one of the England, who's the England men's test physio, came and very kindly drove up from Bristol to speak to and do a rehab session the other day for all the physios. But on the docs, because they all they won't be doing that. They don't have the skills to be doing all the rehab that was shown. Some of it was way over my head, for example. But they still want that knowledge, and that's always useful.
We have Band 7 physios who are dedicated to training our physio team, which I believe is unheard of in our profession. So basically their role is to provide monthly training. We have monthly supervision on a one-on-one basis, and ultimately it's their role to help us to progress and to continue learning, and that is what both of our professions are, medical or physio. It's endless learning basically. So they're basically helping us to achieve that.
And finally, what top tips would you give to people to help them avoid issues around the joints, or to help avoid issues such as arthritis? Are there any exercises better than others, or any diets or supplements which can help?
So with arthritis, it's one of those things. You're likely to have a bit of arthritis in your life, and it's nothing to be scared of. Think of it like grey hairs and wrinkles. You get a bit of arthritis in your joints.
Why'd you look at me then?
Not looking at anybody. So I would just suggest, just do what you enjoy doing. I wouldn't say you need to go to the gym and lift loads of weights or do loads of running on a treadmill. Any sort of movement is going to help and to strengthen your joints and keep them mobile. So whether it's dancing, yoga, tai chi, just do something that you enjoy. Like Glen said, the problems that we're seeing more recently are the neck problems, the shoulder issues, which come from sort of all day sat at your desk, hunched shoulders, looking over your laptop, that sort of thing. So it's moving in a way that you're going to enjoy and you're going to basically keep doing. So I wouldn't say one size fits all, but that's the best way to sort of keep yourself supple and moving. So I wouldn't say there's one exercise better than other, but we do know that it's strength and mobility generally that's going to help.
I think that for those, if people are sort of listening to this and are keen to start exercising and perhaps haven't done so for quite some time for whatever reason, I think it's quite daunting, quite difficult, especially to go to a gym. And there is referrals that can be gained from GP and from health coaches, social prescribers who are now available within primary care. And sometimes I think it just takes a little bit of getting started to the point where you can then go and do those exercises. And I think one way of doing that is general mobility. So I think walking is great. Things like the couch to 5K are super, but that doesn't have to be a run. That could be a walk. And if you just Google, couch to 5K, I think that will give a bit of a program to start doing that and get more miles in the legs. There's also things like park runs. So there's the park run. I think in Sunderland there's only one at Silksworth. There's probably more than one in Sunderland now. There's only a lot over in the Newcastle region. But if that seems a little bit too far a step initially, then using the Sunderland IMS.co.uk website and registering with the Move With Me will give you general strengthening exercises that can be done, and they can all be done at home, and they don't need a great deal of equipment, if any equipment. And I think starting to do that, benefit will be gained within a couple of weeks. With regards to other sort of activities that I personally think are really useful, I think swimming and cycling are probably ideal. They're not weight-bearing exercises, and if you're just even to walk in the pool, and you're walking with your up to your waist in water, 50% of your body weight's off you. So you get the exercise, but you don't get the force going through your knees, for example. But as you develop, up to your shoulders, 80% of your body weight's off you. So the more you do of that, the stronger you get, and then you can start moving onto dry land, basically. Cycling similar, there is no forces going through those knees. On a static bike is a great way to get going and to start that exercise. Right,
thank you, Glen and Nia, for taking the time to come and speak to us today. Thank you for listening to today's episode of Our People podcast, and make sure to check out our Spotify and YouTube channels to listen to other episodes which help explain what all the different departments and services we offer do. Once again, thank you.
Pleasure. Thank you.
Thanks for joining us for this episode of Our People podcast. We hope you enjoyed it, and check out our other stories. Hit subscribe to keep up with the latest and catch up with what we've been up to on our Twitter, Facebook and Instagram pages. Just search for our name.